Okay, so now we're going to move into talking about health screenings and disease management. So why should you get an annual health screening? It's really important to go to the doctor and get at least just a basic checkup and physical at least once a year, because this can help detect and prevent chronic illnesses such as heart disease, diabetes, and various cancers such as breast cancer, cervical cancer, and colorectal cancer. How often should you get these screenings? Most screenings are done on a yearly basis based on your age. Many of the screenings are age specific, so based on your past health history and how old you are will determine what screenings you should get. So some examples are cervical cancer screening should be done between the ages of 21 and 65 years old on an annual basis. Breast cancer screening should start at the age of 50 and be done on an annual basis until you're 74 years of age. Blood sugar and cholesterol levels should be done annually starting at age 18. So this is the normal typical blood work that you get when you go to the doctor for a physical exam. And colorectal cancer screening should begin at the age of 50 and last until you're about 75 years of age. So you might be thinking, how am I going to be able to afford going to the doctor once a year to get a screening when I feel perfectly healthy and I don't think anything is wrong with me? So with the passage of the Affordable Care Act, refugees are entitled to the same benefits insurance-wise as American citizens. So they have the accessibility to enroll in insurance benefits programs through the Insurance Exchange Enrollment Program. Refugee children have expanded coverage under the Children's Health Insurance Program, or CHIP, which means that they will be covered even if their parents aren't qualified for any sort of Medicaid or federal insurance funding. And insurance companies also can no longer deny membership into them based on pre-existing conditions. So that means if you come into the country with a previously diagnosed heart problem, the insurance companies can't deny you coverage based on that pre-existing condition. Also, under the Refugee Medical Assistance Program, medical facilities in states are reimbursed 100% for any sort of refugee preventive health care that is provided. So this means that even if you aren't eligible to be enrolled in a Medicaid program based on your income level, the Refugee Medical Assistance Program will cover your medical screenings based on your refugee status. So what if you already have a chronic illness? Some of the chronic diagnoses that we're going to discuss briefly are diabetes, arthritis, asthma, and heart management. And really, once you've been diagnosed with this kind of chronic illness, management is really key. So how exactly are you going to provide basic management for yourself for these chronic illnesses? So let's start with diabetes. If you already have a diagnosis of diabetes, blood glucose testing is essential because this is going to help you determine how well your insulin coverage is managing your sugar levels, and it will also help you be more compliant with insulin administration. Insulin compliance is a huge, huge component of diabetes disease management, as well as meal monitoring. So you want to make sure that you are eating meals that are beneficial to your blood sugar levels. And you also want to really make sure you are obtaining good foot care. So a lot of diabetes complications occur because of a decreased circulation to your places like your feet. So you want to make sure that you're checking your feet once a day, make sure you're wearing shoes around the house, and if you start to notice you have some sores on your feet, go to your doctor to get them checked out. If you have arthritis, again, medication compliance is a huge component of managing this illness. Also, making sure that you are staying active and making sure that you are eating healthily so that you don't add any unwanted weight will help to manage this illness. All right, so asthma is another big one that affects both children and adults. So if you already have asthma, you want to make sure that you have an asthma action plan. So that is basically a green, yellow, red type of plan that your doctor should give you, where it'll tell you at each stage what kind of medications you should use and when you should go to see the doctor. So in the green stage, you're just maintaining your asthma using your regular maintenance inhalers. If it's starting to get worse, you're starting to use your rapid acting inhalers. And if you are finding that you need your rapid acting inhalers more frequently, you're in the red zone. That means that you need to go to your doctor and get checked out. It's also really important that you get a yearly flu shot because asthma can be triggered by illnesses such as the flu. And then finally for asthma, it's really important that you know what triggers your asthma attacks so you can try to avoid those types of things in the future. And finally, heart disease. If you have a diagnosed heart disease, you want to make sure that you're following a diet that's low in cholesterol, one that's considered heart healthy, and that you're exercising regularly so that you can keep your heart healthy and happy and everyone's okay. And now we'll go into community-based stuff.